Today, so let's go ahead and get started. My name is Emma Schwartz. I'm the president of the Medical Center of the Americas Foundation, and I'm really excited to bring to you this exciting webinar that, again, is not in webinar format. So if you can please put your view on speaker view, then you can see the speaker's face a little bit bigger. But in this view, our speakers can see your faces better and your reactions. So thank you all for being here today. The purpose of today's meeting is to provide you all, who I know are all the folks in town who tend to plan and execute events in our community. And those events can be nonprofit fundraisers, cultural events, weddings. And COVID has obviously disrupted our ability to do that effectively in 2020. And unfortunately, we're not done. And so what we've done today is brought to you a couple of healthcare, medical and public health experts to talk to you about the pandemic and its trajectory, and when we think we'll get to a new normal, what new normal will look like. But we also have some great legal experts with us today who will be able to talk to you about the legal aspects of holding events. So it's not just about your personal judgment as to whether you can gather safely. We need to make sure that we stay in compliance with our city and county ordinances. And so with that, let's go ahead and get started with our first speaker. Again, a reminder, if you put it on speaker view, his face will get much bigger when he starts to talk. But our first speaker is Dr. Ogechika Alozie. Dr. Alozie is a graduate of the University of Minnesota's Infectious Diseases Fellowship Program. He received his medical degree from the University of Benin in Nigeria and completed an internship and residency in Minnesota. He's also board certified in clinical informatics, making him one of less than 100 such certified physicians in the state of Texas. He was most recently the chief medical officer at Del Sol Medical Center, where he oversaw clinical quality, physician alignment, and partnered on healthcare innovations. He's presently the CEO of Southwest Viral Med, a nonprofit organization in El Paso responsible for the care of clients living with HIV. As a chair, co-chair, or member on multiple local and state committees, he represents El Paso, focused on how health information technology can improve care. With that, I will turn this over to Dr. Alozie.
There we go. Can you hear me, Emma?
Yes, I can.
Perfect. So good afternoon, everybody. Give me a minute. And can you see my screen as well?
We can.
All right. So I'm going to apologize straight off the bat. I'm sure it says 10 minutes on there, and I'm not going to try to take too much time, but I do think it's important as we sort of have this conversation that it's not just about where we're going, but kind of where we are, right? And I'm a really strong believer of you can't throw the ball to where the receiver is going to be if you don't know where you're planted at the moment. And so I'm going to do a sort of quick dive. I'm not going to talk about the epidemiology or the numbers or any of those things around COVID. Hopefully you've heard that ad nauseum. Hopefully you also know where to go find it, elpasostrong.org. And so I'm a big resource guy. So if you want to go find something, that's the best place to find it from an El Paso standpoint. But if you can see my screen, I am going to go over this because I truly believe, and I've been saying this for some time, that vaccines are the answer to all the questions that anybody on this call is going to have. And I think that is really where my ask will be. Usually, right, as the presenter, there's no ask. Usually I just tell you to come and talk, and hopefully you don't talk too long, and hopefully you don't put people to sleep. But my ask at the end of the day is going to be to challenge the people on this call and say, what are you doing to ensure that our community gets vaccinated? And I'll explain to you why that's going to be so important. This is a picture of the coronavirus. Y'all have seen it before in various shapes, sizes, or forms. Obviously, it's an illustration. It's not the actual coronavirus, and it's not that big. But here's what I'm excited about. 2020 is the year of the vaccine. It obviously was the year of COVID, SARS-CoV-2. We've passed 500,000 deaths, unfortunately. But I truly believe that for us to honor those lives that are lost, we have to put in the work to prevent future losses of lives. And this is all going to make sense in the context of what Mr. Schwartz set up as, well, what's going to happen into the future? And so bear with me while I sort of run through this. Again, one of the things that people ask all the time is, well, why should I take this vaccine that you took less than 11 months to create? You're right. It's the fastest vaccine ever. And you know what? That's okay. Because one of the things that people don't realize is that the vaccine is not a new process, and it held true to the science. SARS, which was the sudden acute respiratory syndrome, was 2002, a cousin of SARS coronavirus 2. MERS, the Middle Eastern Respiratory Syndrome, was 2012. It was actually in 2013 that scientists in Europe and the NIH identified the spike protein as a so-called Trojan horse or backdoor to actually create a vaccine. There was just no need to create a vaccine because, yes, MERS did kill people, but it wasn't this kind of global pandemic. I think it's also important for people to remember that there was this little thing called Operation Warp Speed. And you may say, well, Dr. Alozie, what is this Operation Warp Speed you speak of? Again, you may not be able to see all of this, but I think it's important to understand that Operation Warp Speed was a catalyst behind why we have vaccines right now. Johnson & Johnson, who FDA should be approving hopefully either this evening or tomorrow morning, got $1 billion from them. Moderna, that many of you have already had and many of the community have already had, got $1.53 billion. And so typically when somebody goes to vaccine production, you do phase 1 and then you go look for money. Right? They ask nonprofits, the governments, foundations for billions of dollars, and they got to sit on their hands for about 5 years. Then they go to phase 2, then they go to phase 3. Operation Warp Speed allowed all these companies to run things in parallel instead of serial. And I know some of you are engineers and engineering departments, and so you can completely understand that redundancy. It also allowed these manufacturers to produce vaccine after phase 2, so that they had a stockpile of millions of vaccines. Typically, they would have finished phase 3, gotten approval, and then started to produce. We probably wouldn't even have vaccine today if that was the process. And so I think that's really important for people to understand. And so this is the timeline from the time that we first discovered SARS-CoV-2 in December of 2019, all the way to December 11th. Again, every process, every step was followed. And so it may have seemed rushed, but it was quick. I think that's the term that we need to use. And I'm also going to ask those of you that are in public relations and media, we have failed immensely in the messaging around coronavirus. And so I'm going to use various phrases that I think are better. Instead of rushed and hasty, it was just quick. It was catalyzed. It was enhanced. This is the language that we have to give to our communities if we actually expect them to trust us and go get that vaccine. You may or may not want to know how the vaccine works. mRNA, lipid polymolecule particle, goes into the shoulder, body picks it up, says, wow, this is interesting, never seen this before. Let me create some antibodies to this. And then if you get into the space of coronavirus, it protects you from it. Another way to look at it, and I love this cartoon that I saw on Twitter, is there's this random loose mRNA lying around in your deltoid. Nobody, right? The ribosome, which is actually where that mRNA goes, says, let me go ahead and transcribe this. Then the macrophage bounces around. Yo, check out this cool spike protein I found. And the T cell's like, dude, WTF is that? Get rid of it. Where's Bob? Your body gets rid of the mRNA, and then Bob is your B cells, the antibodies. It's like, yes, and the T cell tells Bob, hey, if that ever shows up again, got it. And that is essentially how the mRNA tells your body to create protection for you. Again, really quickly, the key things here is that it doesn't give you COVID. It doesn't affect your DNA. Once it's injected into your body, it actually disappears within 72 hours. Some people actually believe it's faster, and your body ingests it, destroys it, and it's gone. It's not live virus, and that's really important. Next step, the EUA. Hopefully you've heard what this is, emergency use authorization. That's what FDA has given all of the vaccines around the market and what we expect to have soon. Again, you've heard of Moderna, not going to belabor it. This is the graph that you may or may not have seen. The blue graph is those that did not get a shot. The red, the blue line, not graph, the blue line, and the red line is those that did get a shot. The risk reduction in this is approximately 95%, right? And so that is amazing. Remember, the a priori, or the prior to phase 3 clinical trial line that was set by the FDA was 50%. And so this is far and above beyond that 50%. The other thing about Moderna that was great that they did is that they actually looked to see an important question. Can these vaccines stop transmission? And so they swabbed people pre-dose 1 and pre-dose 2. And what they found was that there was about a 60% reduction in the transmissibility or the presence of viral DNA or RNA in the people's nasopharynx, for those of you who have gotten that swab. Very important, park that in the parking lot. The Pfizer vaccine, similar graph, right? And the Pfizer actually looked to see when did those bars actually start to splay. And you can see right around here, it's around day 11 or day 12 after the first injection that the populations changed. But again, also about 94.8% difference between those that were placebo, got nothing, and those that got vaccine. Amazing scientific process. And I think that's important. You've heard about the side effects, not going to belabor that. Usually worse after the second dose for those of you that have gotten it. I think what's also interesting about it is that what has been shown is that, number one, those that have gotten COVID previously and then get the immunization series tend to have more side effects, which makes sense, right? Your body's responding again. The exciting thing about it, and that's not ready for prime time today, but it will be in the future, is those people create 10 times more antibodies than somebody that gets vaccinated and has never had COVID, right? And so there's a conversation that you're hearing in some resource poor countries that they may give them one shot if they've already been positive. But again, that's not what we're doing in the United States. Just wanted to call that out. This is important because, again, people talk about the side effects as a reason they don't want to get it. But I've had 68-year-olds and 72-year-olds tell me, well, I'm not going to get it. And then I look at their medical record, but you got the shingles vaccine. And they're like, absolutely. Well, this is way better than the shingles vaccine. Right. And so, again, this is sort of a medical thing that I use to convince people, but you can see from left to right, worst to best in terms of vaccines and how much they are producing side effects. Just kind of food for thought. If you wanted to compare Pfizer to Moderna, essentially there is no difference. The biggest difference is the cold chain storage required for Pfizer. Pfizer also goes down to 16 years old. Moderna doesn't. Both of them are enrolling children down to the age of 12. That's another conversation that we can have for another day. And I really like this slide because this is really the difference, right? Those of you that remember those old Budweiser commercials, taste great, less filling. That's the argument. They're the same vaccine. Get it when you can. Johnson & Johnson, super excited about Johnson & Johnson. What you may have heard, and again, this is where the press has done us a disservice consistently during the COVID pandemic, is the top line number, or what the military would say the bluff, right? The bottom line up front is 66 effective against moderate and severe disease. That is correct, but this was also a vaccine that was tested in Brazil and South America that had the variants, right? I actually have started to say variant schmariants because I really don't care about the variants. But again, I think it's important to understand that that was the context under which they were tested. So you would expect to have less efficacy. Here's the number that's important. And I really need people to understand this when they're talking to their friends, family, and the community. 100% efficacy against severe hospitalization and death. That's the takeaway, right? And I'll sort of drive into that. Again, this is that graph. You can see the placebo group in red got sicker or had more infections than the percentage that got Johnson & Johnson. But I think it's also important to remember that with Johnson & Johnson, one shot, so you don't have to worry about that 10 to 15 drop off of people coming back, requires only a normal refrigerator. So you don't have to drop about 20,000 per ultra cold storage, which people are struggling with, right? And it also protects 100% against hospitalizations and death. And so this is really why I'm excited about that. And they also incorporated into their study, hey, is this going to stop transmission? And they found about a 75% reduction in transmission. So when I sort of take all of these together, you can see Pfizer, Moderna, J&J, Novavax is not here yet, AstraZeneca either. But again, you can see the efficacy. It gets really complicated in this graph. And so I like this graph better. And I'll call your attention to this line that has yellow. Apart from Moderna, and this person did have a severe reaction, went to the hospital, everything else in terms of hospitalizations and death is 100%. The take home here is if you have the opportunity to get vaccinated, whether you're here or in a foreign country, get the damn shot. right? That's my take home now to everybody. Don't ask me about the differences. Get the shot when they call your number and go and get it. The exciting thing too, and finally, I mean, there's a group of us that have been on IG Twitter for about a month plus saying that, hey, these vaccines are going to they're going to reduce transmission, and people have been fighting us and adding us and blah, blah, blah. And finally, Dr. Fauci came out yesterday and said his daughter's getting her second shot. He has every intention of hugging her when she comes home, because she'll be 2 weeks past her second shot, and he expects the vaccine to reduce transmission. And that's how we put an end to the pandemic, not an end to COVID transmission. That may never happen. That may not happen this year or next, but changing and defanging severe hospitalizations of COVID into the normal cold, potentially the flu. And remember, the flu kills 50 to 80,000 a year as well. All right. Really quickly, hurdles ahead. Hopefully you've all seen this or you're all aware of it, the 1A, 1B, 1C. Again, it's a mess, right? First of all, from the federal government, it was a mess. Various states were able to do Tutti Frutti, Vanilla, or Rocky Road, also a mess. I think it was important that healthcare workers got it first and people living in long-term care facilities got it first. Remember, 30% of all the deaths in COVID have been in people living in long-term care facilities and people above 75. We needed to protect them first, and that's important. In Texas, we actually expanded it to 1C, which is 16 to 65 with a comorbidity. All right. People ask me about children. I truly don't think children are ready for prime time. The studies are not available. I expect the vaccine to work just as well in children. They may have more side effects. Also, I think people need to understand that kids don't get as sick, they don't transmit as much, and they need to be in school. Talk about that another time. All right. Pivoting to the stuff that you really want to hear. Where are we going with this? Well, here's where we're going with this. We have a problem, Houston, and the problem has gotten better, but vaccine hesitancy has slowed us down. Right there, right now is more demand than supply against the vaccine. We've given about 65 to 66 million, I think. I'll check my counter, but that's what we've given. That's not enough. Israel has given the most in the world, and they've already seen a 70 to 80% drop in transmission across the demographics that they've given the vaccine to. That's the power of it in every community. If you look at it again, which groups are most likely to be vaccine hesitant, you can see, in our community, that would be Hispanic adults on average, again, below the norm, but not terrible. I think what's exciting about it, and this is something that came out of Kaiser last week, it's gotten better in all demographics, right? And so Black, Hispanic, communities of color, the hesitancy has reduced because the more people get shots and the more they stay alive and the more they feel healthy, the more they can tell their testimonials or tell groups like this, or tell their churches, right? Or tell their promotoras, right? That's the power of getting those vaccines into arms. I put this out here because, again, I will reiterate that we have not done a great job of messaging this properly, right? And so I feel sometimes a lot, I have friends that will call me and they'll start arguing me over something that they Googled. And I'm like, come on, man. I mean, I know the 2 extra biology classes I took aren't that important, but don't do this. So again, I think clear messaging, honest messaging, and being frank and upfront are really important. I do people ask about the side effects. I think it's important to be transparent about the side effects, right? And the severe allergic reactions and anaphylaxis. I think it's also important to remind people that as of last week, if I'm not mistaken, February 12th or so, there was 11 anaphylactic reactions in over 25 million vaccinations. Right? That's an amazing number. I could give you saline water as a 500 cc bag, and at least one of you would probably get an allergic reaction to it, right? So the fact that it's been 11 out of over 25 million, I think is amazing. I also call this as a counterpoint. And again, this is where messaging has failed us. I can assure you that if COVID caused erectile dysfunction, everybody, every male at least, and their wives and girlfriends, but every male would be rushing to get the COVID vaccine, right? So it's all about context, right? The same people that complain about shoulder aches and pains, if it was erectile dysfunction, they would get the shot wherever you want to put that shot. And so again, food for thought. I call your attention to this because it's important to remember that vaccines are just a piece of the Swiss cheese phenomenon, right? Or that Swiss cheese methodology, whether it was stay at home, masking, hand hygiene, avoiding crowds, ventilation is huge. Being outdoors is probably one of the biggest benefits to avoid COVID. And so we're blessed to be in El Paso. Vaccines are a piece of it, but they're only one piece. Again, we've known these 4 things from the beginning of the pandemic. Wash your hands, watch your symptoms, wear a mask, watch your distance. But here's the thing. We can't continue to tell people that COVID is the same as the flu when the numbers don't line up. We also can't continue to tell people that the vaccine's not going to matter and just get it, because people that get COVID, about a third of them continue to have some symptom 90 days after recovery, the so-called long COVID syndrome. And there's a lot of research going into this. I had COVID on the 18th. Me and my wife tested positive, and that's why I have this brace on. My wrist hurts like crazy since then. And I get this resting, I'm at 108, maybe because I'm excited to talk to you guys, but I get this resting tachycardia or high heart rate at least 3 or 4 times a day. Been investigated, heart's great, can work out and everything, but it's just one of those weird things, right? And it keeps me worried a little bit, and I'm not an anxious person. I think all these things are important to really understand. I already talked about schooling and kids. I am passionate about this. Our kids need to go back to school. I have a 14-year-old is back. She's developed an anxiety disorder since this COVID process has happened, and they just need to go back, right? And again, you can be on either side, and I think reasonable people can disagree. But I think once we start vaccinating across the board in the community, the transmission rate will go down. Kids don't get as sick. They need to go back to school. And so if one of the questions is what happens into the future, this has to be part of our drive in the future, right? To focus. Because here's one thing I will assure you that everybody can agree on, no matter what side of the aisle they are politically, financially, or otherwise, they all love their kids and they all want their kids to go to school. Kids don't go to school, parents can't go back to work. And so I think that's just kind of food for thought as we go forward. And so this is an arms race. It's critically important that we get people these shots. And so again, this is the messaging ask that I have for you. Instead of saying you're fully vaccinated against the coronavirus, now what? Don't expect to shed your mask and get back to normal activities right away. That's going to be a disappointment, if not a shock to many people. Failed messaging. Let's rewrite that. It should be, hey, you're fully vaccinated against the coronavirus, which is defined as 2 weeks post-second shot. Congratulations. As more people are vaccinated, you'll be able to shed your mask and get back to normal activities in public. In the meantime, while risk isn't eliminated, it is much safer now to spend time with loved ones, especially those that have been vaccinated. This has to be the messaging. It has to be how we approach these things. 2 vaccinated people 2 weeks after second shot, no masks, no social distancing required. Vaccinated and unvaccinated, maybe keep masks just to be clear that the other person that's not vaccinated, you reduce their risk. But again, the science and data is showing really clearly that there will be a reduction in transmission for people that have been vaccinated. I think that's immensely important. Unvaccinated, haven't been able to get the shot, the same thing that we have always hopefully done. Wear a mask, physically distance, try to be outside, watch your symptoms until you can get that shot. I think that's the key. And the truth is this, when we sort of think about, well, can I hold an event? The question I will ask you is, who's coming? Have they been vaccinated? What's the percentage of vaccination in your community? If the percentage of vaccination is 5%, you're not holding an event with more than 5 to 10 people. If the percentage of vaccination is 50 to 60%, and in El Paso, my estimation, I think the EPI would bear it out, is that 20 to 30% of our population has already been infected. That gets you to 80 to 90% herd immunity. Do what you need to do, right? So that's why. And so when people say, can we have an event? It's maybe. And it has to be about, well, what have you as an organization done to ensure that your people have gotten vaccinated? And I understand that today, as we sit here on February 28th, the vaccines are not available. But I also understand that with the procurement of extra 200 Moderna, extra 200 Pfizer, and 100 million J&J coming online by the end of May, by May, June, there's going to be more supply than demand. And then it's only going to be hesitancy and operationalization of getting people vaccine that will stop us as a community getting that vaccine. And so whether it's flying, I mean, many of you already fly now without vaccine. But when you're vaccinated, I mean, obviously you'll wear a mask just to protect yourself. And there's still that fear of variants, although I'm not as worried about that. But when you get to where you are with your family, enjoy your vacation. If you're planning an event, again, I think it's important to understand, what does the community look like, right? In our community, our numbers are going down. They're going down across the country. I truly believe there's a host of reasons for that. Like I said, I think 20 to 30% of the country and our community has already been infected. You add another 30 or 40% vaccination, you've gotten to a safe place. And more importantly, remember, irrespective of vaccine type, the goal is to message 100% protection against hospitalization and death. When we defang COVID, we're able to practice and engage in the community again. There will never be a time when we get to zero COVID, but I think it's acceptable to understand what risk reduction is and to give that message to people that things will get better, but we have to play a role in that. And I think as large employers and public, nonprofit, for-profits, I think that's part of our goal. And so may we never again take for granted Friday nights with friends, those birthday celebrations, the roar of the stadiums. I miss watching my Cowboys, mornings at the gym, packed dance floors, coffee with a friend, crowded concerts, happy hour. I see somebody drinking coffee. I would prefer bourbon or life itself. And at the end, it's not about going back to normal, right? Normal wasn't necessarily working. If we go back to the exact same way things were, we would have lost the lesson. Hopefully there's a lot of positive lessons we've learned in 2020. May we rise up, do better, to be better. 2020 was about masking. 2021 has to be about vaccinations. I will stop talking, take questions, and kind of go from there. I hope I did that in a little longer than 10 minutes. My bad.
Thank you, Dr. Alozie. That was fantastic. But before we take questions, we're going to turn this over to Dr. Hector Ocaranza. Dr. Ocaranza is a native of Portland. He got his medical degree in Juarez before going on to specialize in pediatrics at Texas Tech Medical School in El Paso. Dr. Ocaranza also received his master in public health from UT Houston School of Public Health here in El Paso. Dr. Ocaranza, could you please talk to us a little bit about what's going on in El Paso with the pandemic?
Yes, thank you very much. And thank you for having this opportunity to speak to all the audience in regards to what's happening in El Paso. And I'll share my screen so we can go through the dashboard, which all the members of the COVID-19 task force work really hard in getting this dashboard ready and up and running so you can give a clear picture of what is happening in El Paso and have a snapshot of what you want to know about the COVID-19 in regards to the numbers. Many people might be very familiar with small numbers. Many people might say, well, I don't like math. I'd rather get some summary of this. All of this is available at your fingertips here in the dashboard, upstrong.org. And that's where we can see where we are, where we're standing right now. And as Dr. Alozie said, we need to know what we have this moment so we can plan ahead and see what we're going to be doing in the near future, mid-range future, long-range future. But COVID-19 has proven nothing but being very liquid, nothing very predictable. That's why a lot of the predictions that were done initially in the pandemic did not apply because everybody was waiting. When is it going to be peaking? When is it going to be exhausting the ICU, the hospital beds? And the truth of the matter is that nobody knew. Why? Because there's many pieces of the puzzle that play a big role in how the pandemic spreads, how the virus spreads. And the interesting thing about the COVID virus is that it has a very long half-life. We don't know if you were infected at that reunion. We don't know if you were infected at the grocery shopping or somewhere else that you were having any other activity. That's why the messaging about the mask, the messaging about the hygiene, the distance, and watching your symptoms is extremely important because those non-pharmacological approaches are the ones that have worked for other respiratory viruses, and it works. We know that it works for also the COVID-19. The vaccine is a game changer, as Dr. Alozie mentioned, and we're all very anxious and very happy to see how the vaccination is received in our community because we know that the vaccines work. We understand a lot of the concerns, but messaging is everything, and the way that we say things can change the view and can give us also a different perspective on what we need to do. Studies are ongoing for the pediatric population, and we know that the pediatric population doesn't get affected the same way as the adults and as the older, especially residents of those congregate facilities. So we need to continue protecting those that live in congregate settings, the nursing homes, long-term care facilities. And if we have a big family, which we all do here in El Paso, in our region, we have multi-generational homes. And that's what we've been seeing that is being affected tremendously, because if somebody comes home with a virus, it's going to be infecting a lot of those people. And we saw the large surge that we had in October, which created a large surge in the hospital and unfortunately people passing away. So far, we have 1 in 7 people getting infected with the COVID-19, but we know that this is not just the true number. There's many, many, many people more that have been infected that maybe did not develop any symptoms or simply didn't go get tested. So the number that we see is those exactly right here. It's just a snapshot of what's happening, but there's plenty more people that already been infected, that already develop immunity, and also play an important factor in the herd immunity. The less people that we have susceptible, meaning the less people that have not been infected that could potentially be infected, the better it's going to be and the slower the virus is going to spread throughout the community. So with the vaccine, with all the people that already have been infected, we will reach that herd immunity hopefully pretty soon. Unfortunately, with the amount of vaccine that we've been receiving from the federal government, from the state, it will take some time before we see a larger number of people being fully immunized. Currently, we have about 18% of the population having greater than 16 years of age, having at least 1 dose of the vaccine, and a little bit over 10% have completed their 2-dose schedule. With the Johnson & Johnson vaccine, which is going to be 1-dose vaccine, we hopefully are going to be able to see a lot more people vaccinated, people that might not be able to come for the 2nd dose of the vaccine, in which some people that are in correctional facilities, people that are more mobile, those people that are homeless, those are the ones that also are considered very vulnerable, that can end up in the hospital. And we do need to protect. There has to be also that equity in the way that we distribute the vaccine, in which we're trying very hard to promote that. Moving over here with infection, we see how we had that large surge that we spoke about a little bit ago in October, in which right now we're seeing a very nice decline and a negative trend that we're seeing. And hopefully we will continue to see that decline in the trend. And as we see this and the conditions are favorable, we will be able to slowly open up more and more to businesses, other venues that are going to be from less risk to more risk, in which our community are going to be seeing the flourishing activities that we used to see even before the pandemic. But we need to remember, we cannot do it just all at once opening, because we cannot just claim victory over the pandemic just right away. We need to be very conscious. We need to be very cognizant that this is just the beginning of something that we need to do it very carefully. So when is that going to happen? Little by little it's happening, and we all need to contribute to make it happen. So we said it that it's up to each and every one of us to do this, and by observing the distancing, continue wearing the mask, because we're not there with a herd immunity. We need to continue inviting people, dismissing a lot of the myths and misinformation that has been spread through social media, in which people might not get the vaccine because they're afraid that this vaccine was produced too fast or too quickly. We know that it's not. We know that the technology has been in the works for many, many years already. And it is a breakthrough in the technology, in the way that we're training our immune system to respond to infection. And that's the way that is wonderful, to have a vaccine that is going to help us fight not just this virus, but many other viruses, because we know that this is not going to be the only infectious disease that we're going to be facing. There might be some other ones. There might be other challenges that we're going to be facing as community. And we still see the people getting to the hospital because of the flu virus. Many children get infected with RSV and end up in the hospital. Many of us have seen the effects of many other infectious diseases, and who better than our grandparents, who even saw vaccine preventable diseases that we don't see nowadays being prevented, like polio, like measles, et cetera, that used to cause a lot of disease and mortality in communities as they were affected. In the hospitalization, we continue also to see a nice decrease, although it has plateaued, and there's still plenty of people requiring higher level of care, not just at home, but in the hospital. But we are hoping that these numbers are going to continue to decline, even though it's slowly, but it will continue having a nice downward trend. And as the percentage of hospitalization in the trauma service area drops below 15%, some of the restrictions imposed by the governor is going to be lifted, and we continue to open up, as we mentioned before. And we will listen a little bit more about all those ordinances and from the legal perspective from the county and the city with Ms. Josette Flores and Ms. Erica from the county. So, unfortunately, many people have passed away from the complications. We know that we are a community that has a lot of pre-existing medical conditions, either genetics, either because of the access to healthcare, some other social determinants of health, which many organizations are helping tremendously, trying to bring that equity into the access to healthcare. So we need to continue looking for the future, for a brighter future, but we need to work toward it, and we need to work as a community, and we need to work together to achieve it. And with that, I'll be happy to answer questions, or maybe at the end, Ms. Schwartz.
Thank you so much, Dr. Ocaranza. Yes, we'll take questions at the end. And great transition, as you just mentioned, we do have our legal experts on the line with us as well. I'd first like to introduce Erica Rosales. She's the Assistant County Attorney for the El Paso County Attorney's Office. She specializes in economic development and has a background in business and corporate law. So Erica, please shed some light on all these ordinances and what is legal in this pandemic world that we're living in.
Thank you so much, Emma. Thanks, everybody. I want to make sure you can hear me first.
We can hear you.
To share. Okay, great.
Yes.
Trying to share my screen here. I'm having an issue. Give me 1 second.
I think if you stop sharing at the top and then re-share.
Okay. Sorry about that. It's sort of blocking me. Here we go. Okay. And you can see my screen okay?
Yes, we can.
Okay. So I want to start by saying, you know, I can't imagine how difficult it is to be running a business right now, to be running it during a pandemic, and then to be trying to stay on top of all of the state and local orders. So I want to start by saying that you have a resource in the county. The website, the email address you have on your screen right now, it's shss@epcounty.com. This is an email address that we had set up at the beginning of the pandemic. It stands for Stay Home, Stay Safe. Again, at the beginning of the pandemic, we had set this up so that folks in the community, businesses and individuals alike, could send us emails and say, hey, this is a specific thing that I need to do. There's so much going on. There's so much changing. Can you help me figure out, can I do this? What do I need to keep in mind while I do this? So that resource is still available for you. You don't have to do this alone. If you have a specific question that I can't answer or our friends at the city can't answer during this presentation, please use that email address to email us. The county judge's office monitors this. The county administration office monitors it. And the county attorney's office assists with answering these questions. So it really is there for you as a resource. That being said, the governor's order and the judge's order are very, very similar. The local orders have to be consistent with the governor's orders. So everything I'm going to cover is really in the governor's order and in the judge's order. I'll cover the highlights for this group. Some of the highlights are that all with what the governor's termed as non-essential businesses, they can operate at 50% capacity indoors. As Dr. Ocaranza had mentioned, this could increase to 75% if our hospitalization rate is lower as far as the COVID population goes. The magic number is 15% over a span of 7 consecutive days, 15% or less. We have not hit that number yet. I checked this morning, in the last 2 weeks, our average for the region is about 17%. So we're close, but we're not there. Once that happens, where we meet that magic number, then occupancy may open up more, but that just hasn't happened. So right now we're at 50%. For outdoor spaces, if you're a restaurant with like an outdoor patio or a courtyard, something like that, there's no occupancy cap for outdoor events, but I should say you still have to have the space for social distancing. So you just can't have a packed, outdoor area. It has to allow for social distancing. There's some other minimum health standards I'll talk about at the end, but that's at the very least, that has to be in place. I will say there is an occupancy limit for some outdoor events. So if you're like an amusement park, a water park, a museum, a zoo, something similar to that, that is capped at 50%, in addition to having to have social distancing guidelines set into place. Professional sporting events are allowed, things like locomotives games, right? Chihuahuas, rodeos, things like that. You can have spectators at 50%. As an aside, I'll mention this because we get this question all the time. What about non-professional sporting events, right? Little leagues and adult recreational sports. That could be a presentation of itself. To simplify it, I will say there are guidelines, or I'll share the resource at the end, for every type of sporting event you could think of, as far as youth sports, adult sports, that kind of thing. They're allowed, but you can't have the same kind of spectators as you can imagine that you could have like at a locomotive game, right? Where there's staff monitoring the crowd, that kind of thing. It's very different. As far as planning events in 2021, the orders for the governor and the judge have really remained the same since the fall. There hasn't been a whole lot of changes. So if you've gotten accustomed to the orders in the last several months, they are pretty much consistent, the same. If you're a wedding venue, you could still have weddings, again, with those occupancy limits being one of the most important things in mind. 50% for indoors, outdoors, no occupancy, but you have to be social distanced. Face coverings are still a mandate. So guests have to wear a face covering over their nose and mouths. Events at restaurants are still allowed. Hotels can still host events. Live performances are allowed to happen under the orders. Movies are able to open, bowling alleys. I'm sure there's many events I'm not thinking of. Any kind of event almost that you could think of that is tied or connected with like an employee, a place of business, right? An event organizer, something like that. That is all still allowed. I will mention that these openings are specific to businesses. The idea, I think, was to help businesses to continue to operate, but do it in a safe manner. So we'll get the question about, well, what about social things? What if I want to have a wedding in my backyard, right? With 50 people, it's not a venue, it's an informal thing. Can I do that? The social limits are still in place. You cannot be in groups larger than 10 people. And so if it's not linked with a business, you'd be safe in assuming it's probably not allowed. There are very few exceptions and permissions that could be allowed, but for the most part, unless it's linked to a business, those gatherings really can't be happening. I will mention, the orders have stayed the same since the fall, but as Dr. Alozie and Dr. Ocaranza have mentioned, our numbers have changed. They've improved in some ways. And so just to give an update to the group, 2 weeks ago, Governor Abbott had mentioned, and yesterday he said it again at another event, that they are working the state on evaluating everything that's happening, looking again at the statewide orders and seeing what COVID restrictions they might remove. We don't know what those could be. If it's going to be impacting the businesses to allow them to reopen further or not. We're going to stay posted. The media outlets, I think, have done a great job of like keeping people up to date on the governor's announcements. Certainly the county judge would do the same because it would impact his order as well, more than likely. But one of the questions I get about this from businesses is, if the governor allows for reopening further, do I have to? What if I'm not comfortable hosting an event of 200 people or doing dine-in services, things of that nature? And the answer to that is you should do what you're comfortable doing. If you want to be more restrictive than what the governor is allowing or what the judge is allowing, you can certainly do that. You do not have to reopen at the pace that they're allowing. That's just for people who are comfortable reopening further. So keep that in mind. And the last thing, as I mentioned, the website I mentioned from the governor's office, it's open.texas.gov. That is a good website because they have a lot of one-pagers for all the different types of businesses and events. Like it's really a lot of information there, whether you're a restaurant, a wedding venue, that sort of thing. It has a one-pager on the minimum health standards you have to follow by law, and then recommendations that you just might want to follow to be able to run your event safely. That's really all I have to say. I hope I kept my time. Again, our email address, shss@epcounty.com, if we can assist you with your events. Thank you.
Thank you so much, Erica. And I think about the comment about the sports venues is so important. Someone showed me a picture of a packed high school gym the other day, and apparently a parent called the police and they shut it all down. So there's self-policing going on in our community. And so with that, I'd like to pass it over to Josette Flores. Josette is a senior assistant attorney and has been involved in the city's legal work related to COVID-19. And she's going to talk to us about the city's ordinance. So Josette, welcome.
Thank you very much. Hi, this is Josette Flores. I am a senior assistant city attorney. And the good news is that I will not actually have to say very much because Erica Rosales very ably covered the bulk of the points that are applicable both to the city's documents and the county's documents, because the city, similar to the county, is indeed aligned with the governor's orders. And so the points that she made about the percentages and which are the entities that are subject to a cap versus not, those are also applicable to the city's documents. So that is good. And I also wanted to inform the public that we do have an FAQs component to epstrong.org. So specific questions that you might have are likely to appear actually on our FAQs. Tracy Jerome is the deputy city manager over the quality of life portfolio. And what has been happening lately is that people who have questions specific to whether they can have events that require approval by the city go to Tracy Jerome. So she would be your point of contact. And as far as whether the actual movement by the governor will take place anytime soon is anybody's guess. He's really had quite a few distractions lately statewide. So we're not sure if he will make any changes anytime soon, but we're keeping an eye on the percentages as well. We have not been requested to make any changes to our document because we're still in a high hospitalization area. And another thing that I wanted to mention is that businesses where you could conceivably host an event are, for the most part, I think, being responsible. They are required to post a health and safety type of plan, essentially, that tells people, visitors, and the actual employees that they're required to still wear face coverings and they're required to abide by social distancing. So that is actually a really good thing in terms of where you could be having events. Make sure that the venue actually is being responsible and actually has their health and safety plan posted. That's actually very important. And there are businesses that are providing actual face coverings if patrons aren't arriving with one. Sometimes you dash out of the house and you forget. So the business community, for the most part, I think is doing what it can to actually assist. And I know you wanted to leave time for questions. So I don't really think I should continue at this point to basically repeat information that has already been stated. So I will stop it there.
Thank you so much, Josette. It's great knowing that we have alignment between our city, our county, and our state, because that makes it a little less confusing as we move forward. But I'd like to invite our speakers to provide tips on how you can see events starting to unfold slowly. Like, what are some safety tips that might be new? Like, we've heard a lot about the vaccine passport. And one thing we'd like to know over time is how is that going to impact our ability to gather maybe more relaxed or with fewer masks and that kind of thing. Any comments on that from our speakers? I think there's a legal aspect to that probably in time, right? As well as a health and safety thing. I think that what we've talked about, Dr. Alozie, in the past is that even if 100% of the people who come into your theater have been vaccinated, maybe a few people didn't take to the vaccine so well, but that's a risk we take all the time.
Every day, all the time. Yeah, absolutely, Emma. And so I think here, there's a couple of things to look at when you talk about a vaccine passport. I think it's a nice idea. I think that digital methodology, I mean, I'm a digital health guy, anything that allows us to use our phone to track it instead of that ridiculous piece of paper that most people have already lost. Wait, hold on a second. There's way too much noise on my system. 1 second, please.
We can hear you fine. And the other concern.
Oh, you can hear me? Okay. I was having some crazy feedback. So I guess what I was saying is that I think you got to unpack it. I think digitally it makes sense, right? For people to have evidence of their vaccination. I think that is a great idea. Then we get to the equity standpoint, right? Could you do a digital passport today? Probably not. Like Dr. Ocaranza said, less than 10%. Is it fair to that 50% that haven't even had a chance to get vaccinated that they would be excluded from life or travel? I think not. I think the conversation may be by the summer and early fall when supply outstrips demand. And what we have is people that are vaccine hesitant or vaccine resistant, and they don't want to. Businesses may decide to say, hey, show me evidence that you've been vaccinated. Right? I don't want to be a spreader area. I think, however, at the same time, and again, this is going to be a community by community decision, if a community has gotten to a point, and Dr. Ocaranza comes on TV and says that we're at 70% in June, I think that's a whole different conversation. Right? Then what's the point of this vaccine passport? It's not really adding anything. And the data and evidence would show us that we're going to have a massive reduction. I would guess 90+%. I will say this, I really do think, and I stole this term from somebody the other day in a chat, we're going to have something akin to a summer Woodstock, where because people are going to be vaccinated and happy, and the natural transmission of the virus is going to reduce in the summer anyway, I think that a lot of things are just going to pop from a business standpoint. And so I think that's just important for people to sort of think about and plan.
Thank you. And I will say that we're getting requests for the county's presentation to be posted. And so we are recording this event. So we will post this event for you to share with your colleagues and also pass that presentation along. But since we're talking legal, a question came up. What are the legal implications of requiring a vaccine card for indoor events? Would one of our legal experts chime in?
So Josette, I don't know if you want to chime in, but I think the legal answer isn't as interesting as Dr. Alozie's answer.
Well, for starters, we haven't actually addressed that in our orders yet, is the thing. I think that's probably something that would be started from the governor level and probably kicked around the state, essentially, from county and municipality level. So it hasn't really it hasn't happened yet, is what I'm trying to say.
Let me ask you all this. What have you all felt is the most effective method of communicating your messages on ordinances? Is there a media venue, a media outlet? Is it a certain newspaper? Who's been the most effective communicator, in your opinion, of what message the city and the county legal departments have wanted to put out?
I was looking at the press conference today, right, that was held earlier today, and I just thought everyone seems to show up. I get so many media alerts from newspapers to the TV stations. So I don't know that there's one best one. I feel like they've all been doing such a good job and helping us to spread our message, quite frankly, that I don't know that there's one best way. I will say I think that their websites get a lot more traffic than like the county website might, right? So we appreciate that they've been sharing our message so widely.
Yes, this is Josette. I agree. I actually think the venue of having the press conferences with the county judge and the mayor together, I think are the most effective ways to convey the actual message. And then I agree, the media does a great job of disseminating that message. We do have our Facebook page, and I agree with Erica. I think probably more people visit the media than they do ours.
And if I may, I would like to add also, Ms. Rosales said and Ms. Flores, it is a combination of different ways to deliver the message, and the way that people just spread by word of mouth, by social media, by even just talking to the neighbors. There's different ways that you can approach the target population that you want to reach. But in this case, it has to be the whole community. And as such, it has to be in different methods. It has to be in different languages. And it has to be in the ways that people definitely will understand. So everybody would be very aware without having to have any, I don't want to call it gossip, but people misunderstanding what the orders and what the meaning of those orders are.
So a question just came up about where will this be posted. I can tell you that it will be on the MCA's website, www.mcamericas.com, but we will most certainly push it out to everybody who was invited to this event as well, to the link where it will be posted. I guess it'll also be on our YouTube and Facebook, but we will send out kind of like a newsletter pushing it out, and we'll include the county's presentation. We have a couple more minutes, so I want to give an opportunity for any other questions.
Hi, this is Dave Castillo. I had a quick question. I know Ms. Flores was mentioning a health and safety plan to be included for these special events that are hopefully coming up after June. After reading all these numbers, looks like June's our lucky month to see what happens after June, right? But it's that we're going to have to include a health and safety plan of action, right? Is there anything out there that has this plan of action already in place so that we make sure that we target all the points that the city is going to be requiring for us to have this event?
So the health and safety plan that I was mentioning, sir, is the plan that is already required of actual businesses. So
Oh, okay.
to a restaurant, they need to have something posted so you know what the requirements are. For actual events, what's been happening at the city level is the group will propose what it is that they would like to do, and they work in conjunction with the health department and Dr. Ocaranza to make sure that the event is as safe as possible. And it's not like we are approving all sorts of events recently. If you're in one of the exceptions, then that is reviewed for possibilities. If it is not falling in one of the exceptions that Erica very ably ran through, then it's not able to happen at this point. But hopefully, once the numbers improve and everyone is vaccinated, as Dr. Alozie was mentioning, then we can start up with events again on a wider scale.
So they would be going through the process and getting checked by the health department now and the special public health department to make sure that each event is going to be different in regards to how many people are expected, what are you doing, what are you having, all that stuff will be reviewed by the health department in addition to everybody else that reviews it already.
Correct. Yeah, the health department definitely needs to look at it, and they do work in conjunction with Dr. Ocaranza, the local health authority. Absolutely.
And may I direct everybody to the chat? I put in a URL for the Better Business Bureau. They created a website through a grant. They received a CARES Act grant from the City of El Paso, and they worked in partnership with us at the MCA. It's epbusinessstrong.org, and it provides a whole lot of information that has been legally reviewed, aimed at businesses to kind of help address all these different aspects. And so epbusinessstrong.org, you might be able to find a lot of templates and forms and information on HR processes and other things that have been legally reviewed. There's also a weekly updated list of where you can buy different PPE and different other kinds of stuff to protect against COVID that has, it's a vetted list of vendors. So a lot of information there. So we're right at 3 o'clock. I want to thank everybody so much for being here. I know that this has been an incredibly trying year, and we're not out of the woods yet. It is great to hear that there's a light at the end of the tunnel and that the sun shines a lot in El Paso, and that gives us an opportunity to gather outdoors, which I have not really eaten in an indoor restaurant in about a year. And I think I have the heebie-jeebies even thinking about it. So, you know, we have a lot to overcome. And I think one thing that's really important is trying to give our customers and our patrons and our donors a sense of confidence and comfort as we begin to welcome them back into our venues. And so upholding the highest standards of public health and the masking and just putting a good face forward in that, I think is such a better strategy than trying to be bold and saying we're vaccinated, take the mask off, right? Give people the confidence to go back safely. And it's going to take a while for the psychology to repair in our community until we find that new normal. And so thank you all for all the hard work you're doing to keep your businesses or your nonprofits functioning during this difficult time. Thank you to our speakers who have enlightened us with fun medical and public health facts, as well as legal facts and resources. It's incredibly valuable to our communities. And we will share this video with you all and the PowerPoint presentation and resources. So thanks to everybody. Have a great weekend, and we hopefully will see you soon.